All right, let's dive right in. Have you ever really stopped to think about what it takes to be a nurse? I mean, it goes so far beyond just taking temperatures or giving shots. It's this incredible world of complex science, deep ethics, and just amazing skill. Today, we're doing a high-speed crash course through the absolute core of nursing. So what does it really take? Well, the answer is this fascinating mix of knowledge that covers the human body, the mind, and, the spirit. It's about knowing not just what to do, but really understanding why you're doing it, how to do it safely, and for who you're doing it. So to wrap our heads around this huge field, we're going to break it down into 4 key pillars. We'll start with the moral core, the ethics. Then we'll get into the practical skills for safety. After that, we'll look at the human lifespan. And finally, we'll touch on the science of the mind and the research that keeps pushing everything forward. Ready? Let's do this. First up, ethics. Before a nurse learns a single technical skill, they are steeped in this powerful moral code. And this isn't just a list of polite suggestions, it's the why that guides every single decision they make, from the smallest thing to the most life-altering choice. And these principles, they're not just separate ideas, they all work together. It's this constant balance between actively trying to do good for someone, that's beneficence, and that absolute core promise to do no harm, which is non-maleficence. It's about being fair, that's justice, and being truthful, which is veracity. Autonomy is a huge one. It means the patient is in the driver's seat. And the whole thing is held together by fidelity and accountability. These are the absolute non-negotiables. In this quote, wow, it really drives home just how serious this is. I mean, take accountability. It's not just about saying, oops, my bad. It is the professional and legal ownership of your actions. Think about that. If you give someone a medication, you are responsible for what happens next. That is a heavy but absolutely vital responsibility. Okay, so if ethics is the why, then our next pillar, practice, is all about the how. How do nurses actually take those big moral ideas and turn them into safe, effective, hands-on care? Well, it all boils down to mastering thousands of specific details that keep the patient safe. And some of those details are as basic as how a patient is sitting or lying down. This isn't about being comfy. This is about safety and making sure procedures work. Putting a patient in a high Fowler's position for an NG tube helps prevent them from choking. For someone with swelling in their brain, lowering the head of the bed can be absolutely critical. Every single position has a specific purpose. Here is a perfect example of a tiny detail that has a massive impact. We all wash our hands, right? But what's actually doing the heavy lifting? You'd think it's the soap or maybe the hot water. Nope. It is the simple mechanical action of rubbing your hands together, the friction, that physically kicks the germs off your skin. And that safety mindset extends way beyond the bedside. Even how you throw something away is a critical part of stopping infections. Something like human tissue goes into a yellow bin. But a used syringe, just the plastic part, not the needle, is considered contaminated waste that can be recycled, so it goes into a red bin. You get this wrong and you could spread disease all over a hospital. And when we're talking about safety, precision is everything. To make sure surgical tools are completely sterile, they go into a machine called an autoclave. And the magic number it has to hit is this, a blistering 121 degrees Celsius. That's not a guideline. It's a precise scientific standard that guarantees no harmful microbes can possibly survive. So we've covered the why and the how. Now let's talk about the who. Because nurses don't just care for generic patients. They care for people at every single stage of life, from their very first breath to their very last. And that means you have to deeply understand how we grow and develop. I mean, just look at the first year of life. A nurse knows exactly what to look for and when. That first social smile around 2 months, that's a huge developmental leap. Gaining control of their neck at 3 months, getting a little nervous around strangers at 6, and standing up all by themselves by a year old. These aren't just cute photo ops, they're vital signs of a healthy, developing brain. And what about physical growth? Well, one of the most basic things to track is weight. A healthy baby is expected to double their birth weight by about 5 or 6 months and triple it by their first birthday. For a nurse, this is a super important clue that tells them if an infant is really thriving. Caring for people across their lifespan also means helping them navigate big choices like family planning. A nurse has to be fluent in all of these different methods, from hormonal options to barriers to permanent solutions, so they can help a patient figure out what's truly right for their health and their life. And it's not enough to just know the names of these things. A nurse has to know exactly how they work. So for example, combined oral pills work from the inside out. They actually prevent ovulation from happening at all. On the other hand, barrier methods like condoms work from the outside in. They just create a physical wall. Two totally different strategies to get to a similar result.
And that brings us to our fourth and final pillar, which takes us into the mind. See, nursing care is about the whole person. It's about the deep connection between our mental and physical health. This is also where we talk about the how we know what we know, the research that is the bedrock for everything a nurse does. To understand really complex conditions, nurses often use these handy memory aids. For schizophrenia, the 4 A's is a classic way to frame an assessment. They're looking for disturbances in affect, which is emotion, association, or how thoughts link together, and ambivalence, which is that inability to decide. And for the last A, autistic thinking. Now, it's really important to know this is an older term. It means being really preoccupied with your own inner world. It is not a reference to autism spectrum disorder. You know, understanding mental health is also about understanding how we all cope with stress. A key idea here is the defense mechanism. Take sublimation. This is when a person takes an impulse that isn't socially acceptable, like aggression, and redirects it into something that's constructive and accepted, like becoming a professional athlete. It's a pretty amazing way the mind protects itself.
So, how do we prove all this knowledge is actually correct? Through research. And at the absolute heart of any scientific study is the hypothesis. It's not just a wild guess, it's a formal, testable prediction. So, a nurse researcher might propose a hypothesis like, patient education program A will lead to better blood sugar control than program B. This is the very foundation of what we call evidence-based practice. And that brings us right here to what is basically the ultimate problem-solving tool for a nurse, the nursing process. It's this 5-step cycle that pulls everything we've talked about together. It all starts with assessment, just gathering information, which our sources say is the single most critical stage. It makes sense, right? Because if you don't get the assessment right, the rest of the plan is going to fail. From there, you diagnose, plan, implement that plan, and then evaluate how it all went. So there you have it, a whirlwind tour through the pillars of nursing. When you step back and look at it, from the deep ethical code that guides every move, to the precise skills that keep people safe, to the rich understanding of the entire human lifespan and the scientific research that backs it all up, it's just an absolutely immense foundation of knowledge. But after all of that, after the thousands of facts, the procedures, the theories, it kind of leaves us with one last big question. Beyond all of this incredible knowledge, what is that single, most vital human element that holds it all together? Maybe that is the true heart of nursing.